All right, so welcome to another deep dive. This time we're taking a look at PTSD.
Okay.
We've got a really interesting mix of sources for this one. We've got some medical websites from like the American Psychological Association.
Yeah.
We've got some research articles, even a couple of YouTube videos from experts.
Mm-hmm.
And, you know, our mission here is to really try to get a good grasp on, you know, what PTSD is all about, how it works, what causes it,
Right.
what are the symptoms, how it can be treated.
Yeah.
And, you know, one of the things that really kind of jumped out at me when I was reading through some of this stuff is this idea that PTSD is not just for, like, you know, combat veterans.
Right. Right.
You know, it's not just for first responders.
Yeah.
Even things like the sudden death of a loved one
Yep.
can trigger PTSD.
That's right. Yeah. It really shows how our understanding of trauma and its effects has really expanded.
Yeah.
The American Psychological Association, the APA, defines PTSD as a mental health condition that's, you know, triggered by experiencing or witnessing a traumatic event.
Right.
But it's more than just feeling, you know, shaken up after something bad happens.
Right.
It's like your brain kind of gets stuck in this hypervigilant mode, like it's always on guard for danger,
Okay.
even when you're actually safe.
Right. It's like that internal alarm system is just like stuck on.
Exactly.
Yeah.
Exactly. And that takes a toll, you know, being in that state of high alert all the time.
Yeah.
It affects how you think, how you feel, how you behave.
Right. Right.
But here's the thing. Studies have shown that up to 90% of people who are exposed to trauma will experience some PTSD symptoms at first.
Wow. Okay.
But only about 8% go on to actually develop the full-blown disorder.
That's a huge difference.
Yeah.
I mean, what makes this 8% different?
That is the million-dollar question.
Right.
Researchers are really trying to figure that out.
Right.
Some theory suggests that maybe, you know, you're genetically predisposed to it,
Yeah.
or maybe certain personality traits make you more vulnerable,
Right.
or even just the specific nature of the trauma you experienced.
Right.
Like, for example, someone who's already prone to anxiety might be more susceptible to developing PTSD.
Right. So it's not just the event itself, but also who you are going into it.
Exactly. That's why it's so important to understand, you know, what the symptoms are,
Right.
what to look for, because if you can catch it early,
Right.
that makes a huge difference.
Absolutely. Yeah.
The APA actually breaks down the symptoms of PTSD into 4 main categories.
Okay.
You have intrusion,
Okay.
you have avoidance,
Mhm.
you have negative thoughts and feelings,
Okay.
and then finally you have arousal and reactivity.
Okay. Let's unpack those a little bit. I mean, what do those categories actually look like, you know, day to day?
Well, let's start with intrusion. You know how sometimes you get a song stuck in your head,
Yeah. Yeah. Yeah.
like it just plays over and over again?
Totally.
Intrusive symptoms can be kind of like that, but with memories of a traumatic event.
Okay.
So you might have vivid nightmares,
Okay.
flashbacks where you feel like you're reliving the event,
Right.
or intrusive thoughts that just pop into your head.
Okay.
And these things can be triggered by, you know, all sorts of random things, like a certain smell
Oh, wow.
or a sound,
Right.
you
Right.
know, even watching a news report. It's
Okay.
like those sensory experiences get linked to the trauma.
It's almost like a conditioned response.
Yeah.
You know,
Wow.
even if it doesn't logically make sense.
Exactly. And that can be really scary for people.
Right.
Because it feels like they have no control over those memories.
Right. Right. It just kind of pops up out of nowhere.
Exactly. Exactly. And then that kind of leads into avoidance,
Okay.
which is a really natural response. You know, you want to protect yourself from those intrusive experiences.
Right. Right.
So you might start avoiding certain places or people or
Yeah.
activities that remind you of the trauma. You might even avoid thinking about it altogether.
Right. But wouldn't that, I mean, doesn't that just make it worse?
That's the thing.
You know, in the long run.
It can. It's
It
like
just
this
feeding the fear. Right.
It's like it can be a short-term relief.
Yeah.
But in the long run, it can really limit your life.
Right.
You know, it keeps you from processing what happened
Yeah.
and moving on. And it can lead to social isolation, even problems at work or in your relationships.
So it's like a coping mechanism,
Yeah.
but not a healthy one.
Not a healthy one in the long term, no.
Right. Right.
Then you have the category of, you know, negative thoughts and feelings.
Right.
And this is where you really see a shift in a person's overall outlook.
Yeah.
They might be more irritable or angry. They might struggle with guilt and shame,
Right.
have trouble experiencing joy, you know, the things they used to enjoy.
Mm-hmm.
And they might even develop a a distrust of other people.
Wow.
Like they can't trust anyone.
So it's like PTSD affects not just your memories, but also like your whole view of the world.
Absolutely, yeah. It
Huh.
really colors how you see everything.
Yeah.
And then finally, there's arousal and reactivity.
Okay.
Think of it like your body's stuck in that fight or flight mode.
Right, right.
So people with PTSD might be easily startled.
Okay.
They might feel on edge all the time,
Yeah.
have trouble sleeping,
Right.
trouble concentrating.
Right.
Their body's just constantly on high alert.
Mm.
And that can lead to, physical tension, fatigue, even chronic pain.
Wow. So we're talking psychological and physical symptoms.
Exactly.
Yeah.
It really shows you how deeply trauma can affect a person.
Absolutely.
And it's important to remember that, all these categories are kind of connected.
Right.
So, for example, someone who avoids sleep because of nightmares
Right.
might end up being super irritable during the day
Right. Yeah.
and have trouble concentrating. It creates this vicious cycle.
Mm-hmm. Now, I know we've been talking about PTSD in kind of a general sense.
Yeah.
But in the YouTube video we have from Doc Snipes,
Right.
she mentioned something called complex PTSD.
Right. Complex PTSD or C-PTSD.
Okay. So what's the difference there?
Well, PTSD usually comes from, a single event or maybe a series of events
Right.
that happen over a, limited time period.
Okay.
C-PTSD, on the other hand, is often the result of repeated
Okay.
or prolonged trauma,
Okay.
especially trauma that happens within a close relationship.
Okay. So we're talking about things like
Yeah.
childhood abuse.
Yeah, childhood abuse,
Domestic violence.
domestic violence.
Or like first responders.
Yeah.
Who are constantly exposed to these traumatic situations.
Absolutely. People who are constantly exposed to danger.
Right.
And C-PTSD involves, all those classic PTSD symptoms we talked about.
Right.
But it also includes some additional challenges,
Okay.
like, difficulty regulating your emotions.
Okay.
Maybe you have a distorted self-image
Right.
and real problems forming healthy relationships.
Right.
So imagine, having the fear and hypervigilance of PTSD,
Right.
but on top of that,
Yeah.
feeling deeply betrayed by someone you should have been able to rely on.
Wow. Yeah, that's tough.
That's a lot to deal with.
Yeah. So is CPTSD even an official diagnosis?
It's not yet, anyway.
Okay.
It is widely recognized by a lot of mental health professionals,
Right.
but it's not currently included in the DSM-5,
Okay.
which is the manual used to diagnose mental health conditions.
Right. Yeah.
But there is a big movement
Okay.
to get it added to future editions.
Okay.
Because, the impact of prolonged trauma, especially in relationships,
Right.
is becoming more and more understood.
Oh, yeah.
It's a real thing.
It's interesting that Doc Snipes also brought up, the overlap between CPTSD and borderline personality disorder.
Yeah.
And she even suggested that trauma could be a big factor in BPD as well.
Yeah, that's an area where there's a lot of active research going on.
Where?
CPTSD and BPD are definitely distinct conditions.
Right.
But they do share a lot of overlapping symptoms.
Okay.
And, some experts believe that early childhood trauma could play a role in, in developing either one.
So that kind of leads to a bigger question.
Yeah.
If trauma is at the root of so many mental health challenges,
Right.
how do we even begin to address that? Like, is PTSD even treatable?
That is a very important question. And the answer is yes. PTSD is absolutely treatable.
Okay.
And there's real hope for recovery.
Okay, that's good to hear.
Yeah, the APA, tons of research, they all say
Right.
effective treatments exist.
Okay.
And people can and do reclaim their lives.
It's encouraging. Yeah. So what are some of those effective treatments?
Well, there are two main approaches, psychotherapy and medication.
Okay.
And often the best approach is actually a combination of both.
Okay.
Psychotherapy, particularly the types that are specifically designed for trauma,
Right.
those have a really strong track record.
Okay. So what are some of those trauma-focused therapies?
Well, the APA strongly recommends a few. Prolonged exposure therapy, or PE,
Okay.
cognitive processing therapy, or CPT,
Mm-hmm.
and trauma-focused cognitive behavioral therapy.
Okay. So how do those work? I mean, they sound pretty different.
They do, but they all kind of share this core idea of, helping you process
Okay.
and manage the trauma in a safe and structured way.
Like-
So, for example, with prolonged exposure therapy, you're basically confronting the traumatic memory head on.
Okay. So that sounds pretty intense.
It can be, but it's done gradually.
Okay.
And with the support of a therapist who knows what they're doing.
Right, right.
The idea is that by revisiting the memory over and over again in a safe setting,
Right.
it starts to lose its power over you.
Okay. It's like exposure therapy, I guess.
Exactly. It's like slowly diffusing a bomb.
Okay.
Yeah.
Okay. And then what about cognitive processing therapy?
So cognitive processing therapy is more about changing those negative thoughts and beliefs that often come after a trauma.
Right.
So it helps you to identify, the unhelpful thought patterns
Right.
and challenge them.
Okay.
And kind of develop a more balanced and realistic view of the trauma.
Okay. So it's like reframing how you see the trauma.
Exactly. It's recognizing that even though what happened was terrible,
Right.
it doesn't have to define you. It doesn't have to control your future.
Yeah.
You can still have a good life.
Okay. And then trauma-focused CBT.
So trauma-focused CBT combines kind of elements of both exposure and cognitive restructuring.
Okay.
So it not only addresses the memories,
Right.
but it also helps you manage the ways those memories are affecting your life now.
So it's like a multi-pronged approach.
Exactly. It's about hitting it from all angles. And then, you have medication, which can be really helpful, especially for managing those really intense symptoms like anxiety, insomnia, depression.
Right.
The most commonly prescribed medications include antidepressants,
Okay.
particularly SSRIs and SNRIs.
Okay.
Those can help regulate mood and reduce anxiety.
Right.
Anti-anxiety medications can help with, panic attacks and things like that.
Okay.
And mood stabilizers might be used for, mood swings and irritability.
Okay. So it sounds like finding the right medication and dosage is a pretty individual process, right?
Absolutely.
It's not a one-size-fits-all situation.
It's not about masking the problem. It's about supporting you
Right.
while you do the work of healing.
Right. Right.
It's about getting you to a place where you can, engage in therapy
Right.
and really work through those difficult emotions.
Right. Right.
But it's not just professional help that matters.
Yeah.
Self-care is really important too.
Right.
It's like getting enough sleep, eating a healthy diet,
Right.
exercising regularly.
Right.
All those things can help to regulate your nervous system
Okay.
and build resilience.
Right. Right. It's like you're creating a solid foundation.
Exactly. You got to take care of yourself.
Yeah.
And, social connection is important too.
Right.
Spending time with people you care about, doing things you enjoy,
Right.
seeking support from others who understand what you're going through.
Right.
All those things can make a world of difference.
So it's not just professional help. It's also about taking care of yourself
Yeah.
and your relationships.
It's about the whole package.
Yeah. Yeah, absolutely. So this has been incredibly informative. But I do want to pause here for a second
Okay.
and, see what's resonating with you, the listener.
Mm-hmm.
What are you thinking about right now?
Yeah.
What questions are coming up for you? We're going to be back in a moment to explore more about the path to recovery
Okay.
and hopefully answer some of those questions.
Sounds good.
So stick with us.
Yeah, we'll be right back.
And we're back, continuing our deep dive into PTSD. Before the break, we were talking about the importance of self-care and support systems. But I want to kind of circle back to those treatment options. It seems like, there's no magic bullet here, no one-size-fits-all solution.
You're absolutely right. What works for one person might not work for another. It really depends on the person, what they've been through, how severe their symptoms are. And the journey to healing often involves like a mix of different approaches. Someone might start with medication, for example, to manage, really bad anxiety or trouble sleeping.
Right.
And then once those symptoms are a little more under control, they can start digging deeper with therapy.
Yeah. Makes sense. It's like you need that solid ground before you can really start, unpacking all that trauma.
Exactly. And speaking of unpacking, Doc Snipes mentioned that education is a crucial first step,
Right.
especially for people with complex PTSD who might not even realize that their symptoms are connected to, past trauma.
Right. So it's about raising awareness, not just for people who are struggling, but for everyone. We need to understand what trauma looks like, how it affects people.
Absolutely. Breaking down those stigmas is so important. We have to create a space where people feel safe talking about their experiences, seeking help without feeling ashamed.
Yeah, for sure. And, the APA website really emphasized that it's never too late to seek treatment for PTSD. even if you've been struggling for years.
Absolutely. There's always hope for recovery. It's really about understanding that healing is a process. It's not like flipping a switch.
Yeah. There's no deadline, no expiration date. So we've talked about finding the right therapist, someone specializing in trauma-informed care.
Yeah.
Any practical advice for people on how to actually find that person?
Well, your primary care doctor is a good place to start. They can often give you referrals. Or, you could reach out to organizations like the International Society for the Study of Trauma and Dissociation.
Okay.
Or the EMDR International Association.
Right.
They can usually connect you with qualified therapists in your area.
Right. And the APA website mentioned telehealth, too, especially for people in rural areas or who have a hard time accessing in-person care.
Yeah. Telehealth has become more and more common, and the research shows that it can be just as effective.
Okay, good to know. So you mentioned EMDR earlier. What exactly is that, and how does it actually work?
So EMDR stands for eye movement desensitization and reprocessing. It's a type of therapy that uses bilateral stimulation, which is usually eye movements, while you're processing those traumatic memories.
Right.
And it's thought to help kind of reprocess those memories in a way that lessens their emotional punch.
Okay.
It reduces the distress they cause.
It sounds a little unconventional.
It is kind of out there, but if
Yeah.
it works, right? Right.
And there's actually a lot of research that backs it up.
Okay. So it's worth exploring if you're, interested in something a little different.
Definitely.
What about those conditionally recommended therapies that the APA mentioned?
Yeah.
Like a brief eclectic psychotherapy. What's that all about?
So brief eclectic psychotherapy basically pulls from a bunch of different therapeutic approaches
Okay.
and, tailors them to the individual.
Okay.
So it might include elements of cognitive therapy, psychodynamic therapy, even creative arts therapy.
Right. So it's really personalized.
Yeah, very much so.
Yeah.
It's about recognizing that everyone's journey is different.
Okay. Okay. So that makes sense. We've been talking about PTSD as if it's like this one thing, but it really affects people from all walks of life, right?
Oh, absolutely. The research article from the American Journal of Medicine specifically mentioned domestic violence and natural disasters as potential causes, right? And, domestic violence is, unfortunately, incredibly common. And being exposed to that kind of abuse and control
Right.
over and over again,
Right.
it can be incredibly damaging to mental health.
And imagine, living in that constant state of fear, never knowing when the next outburst is going to happen.
Yeah.
That kind of chronic trauma, it can absolutely lead to PTSD or even C-PTSD.
Right. And then you have natural disasters, too.
Yeah.
Like hurricanes, earthquakes. Those can be so traumatic. Suddenly losing your home, your belongings, even loved ones in some cases. It can really shake your sense of safety and security.
Absolutely. And the APA highlighted that even events that aren't, immediately life-threatening, like the sudden death of a loved one, can trigger PTSD.
Right. It makes you realize that trauma isn't just about those big, dramatic events. It's about loss, too.
Yeah.
Those smaller losses that can still have a huge impact.
Exactly. And I think that's what's so important to remember. Everyone's experience of trauma is valid, and it deserves to be recognized and supported.
So how do we change the conversation around PTSD? How do we make it okay for people to talk about it, to get help without feeling ashamed or judged?
It starts with education. We need to learn about PTSD and C-PTSD, recognize the symptoms, the warning signs, and we need to be willing to listen to people's stories without judgment, to offer support and encouragement.
The Stanford YouTube video really stressed how important it is to be able to recognize the signs of PTSD in kids and teenagers,
Yeah.
because they might not have the words to express their distress.
Right. They might not be able to articulate what's going on, so their symptoms can show up in all sorts of ways.
So what can parents and teachers and caregivers do to support young people who might be dealing with PTSD?
Well, the most important thing is to create a safe and stable environment. They need to know that they're loved, that they're protected, that they can talk about their feelings without being judged, and early intervention is key. The sooner a child or teenager gets help, the better their chances of recovery.
Are there specific therapies designed for, kids and adolescents with PTSD?
Yes, there are. They've taken those trauma-focused therapies and adapted them for younger age groups, and they can be incredibly effective.
Okay.
Helping kids and teenagers process their trauma, learn healthy ways to cope. There are also medications that can help manage the symptoms, but that's something that should always be discussed with a qualified doctor.
Right. So we've covered a lot of ground here. We've talked about different types of PTSD, the symptoms, the treatment options. But before we wrap up, I want to go back to something Doc Snipe said in her video. The body keeps the score. What does that even mean? And why is it important to understand, in the context of PTSD?
It's such a powerful statement, isn't it? It reminds us that trauma doesn't just affect our minds, it affects our bodies too. That constant state of hypervigilance, the surges of adrenaline, the cortisol,
Right.
it all takes a toll.
So are we talking about like chronic pain, headaches, digestive problems, even heart problems?
Exactly. Trauma can really work out with our nervous systems, and that can lead to a whole cascade of physical symptoms.
And if those symptoms are ignored,
Right.
they can make the psychological distress even worse.
Exactly. It just creates this vicious cycle, which is why that holistic approach to treatment is so important.
Yeah.
We have to address the physical symptoms along with the emotional and psychological ones.
And that's where those self-care practices we talked about earlier can really come in handy, right?
Absolutely. Things like yoga, meditation, breath work, they can help us reconnect with our bodies, calm down our nervous systems, and start to feel safe and grounded again.
It's like learning to listen to our bodies again.
Exactly. To pay attention to those signals
Right.
and learn how to manage those fight or flight responses.
This has been a really insightful deep dive. Before we move on to the last part of our show, what's one key takeaway you want our listeners to remember?
I think the most important thing to remember is that PTSD is a real condition, and it's treatable. It's not a sign of weakness. It's not a character flaw. It's a normal reaction to abnormal events. And with the right support, recovery is absolutely possible.
So if you're listening and you think you might have PTSD, please reach out for help. Talk to someone you trust. Connect with a mental health professional. Try some of the self-care techniques we discussed. You don't have to go through this alone. There are people who want to help.
We'll be back in a moment to answer some of your questions and share some additional resources in the final part of our deep dive into PTSD.
Welcome back to our deep dive on PTSD. We've talked about a lot of different aspects of it, but before we wrap up, I wanted to touch on those conditionally recommended therapies that the APA website mentioned. How are those different from the strongly recommended ones?
Well, basically, the conditionally recommended therapies just have maybe not as much solid research behind them
Gotcha.
as the strongly recommended ones like prolonged exposure or CPT.
Okay.
They might be newer therapies, or maybe there's just not as much data on how well they work for, certain groups of people.
So it doesn't necessarily mean they're not effective.
Right.
It just means we need more research.
Exactly. And they could be a great fit for some people,
Okay.
depending on their needs and what they prefer.
Right.
Some examples are EMDR, which we talked about a little bit earlier,
Mm-hmm.
and narrative exposure therapy, which focuses on helping people to kind of create a story out of their trauma.
Okay. Interesting. So it's all about finding what works for each individual.
Absolutely. And that's why it's so important to have a good therapist,
Yeah.
someone who can really assess your needs,
Right.
understand what you're looking for,
Mm-hmm.
and help you navigate, all the different treatment options.
Right. Okay. So let's say someone's listened to this and they're thinking, this is me. I think I might have PTSD. What's the first thing they should do?
Reach out. Talk to somebody.
Okay.
A friend, a family member, their doctor, a therapist,
Right.
anyone they feel comfortable with. You don't have to go through this alone.
Right. The APA website had a whole section on finding help. They listed some organizations like the National Center for PTSD
Mm-hmm.
and the Anxiety and Depression Association of America.
Right.
Great resources.
Those are good places to start. And remember, there's no shame in asking for help.
Right.
It actually takes a lot of strength.
Absolutely. And, I think it's important to be patient with yourself, too.
Yeah,
Healing from trauma, it takes time.
it does.
There can be good days and bad days.
Mm.
But with the right support, you can heal.
You can.
You can reclaim your life.
That's so important to remember. Healing is a process. It's not, a quick fix.
Right.
It's about taking things day by day
All right.
and celebrating those small victories along the way.
And remember, you are not your trauma.
Right.
You're not defined by what you've been through.
Yeah.
You are strong.
You are resilient.
You deserve to live a happy life.
Absolutely. So if you're struggling, please reach out. There is hope. There is help out there.
Thank you for joining us for this deep dive into PTSD. We hope you found it informative and helpful. We'll see you next time for another deep dive.